My name is Anikwe Rambawajende and I'm going to give a presentation on electronic health records. Welcome to my presentation. By starting by an introduction, giving a definition of electronic health record to have a general understanding, electronic health records is an electronic version of patient medical history that is maintained by the provider over time. In other words, it is a computerized system um, that medical practice is using instead of using paper charts. It may include all the key administrative and clinical data relevant to the person's care under a particular provider, including demographics, progress notes, problems, medications, vital signs, past medical history, immunization information, laboratory, as well as radiology reports. So uh, this is according to the Centers of Medicare and Medicaid. Uh-huh. Moving on, the components of electronic health records that they support direct clinical care. According to Carter 2014, clinical components uh, that support like component of electronic health records that support direct clinical care are clinical components, which include computerized provider or order entry, electronic documentation, nursing components, as well as pharmacy system. These are the components of these are the components of the first component of electronic health records that support direct clinical care. The second uh, the other is computerized provide order entry, which allow healthcare providers to enter directly into their computers orders that are needed for patient management. We have also this component make the use of clinical decision uh, support tools such as drug to drug, drug allergy, and drug diagnosis interactions. So there is also in clinical component, there is electronic documentation by provider, which allows healthcare providers to document notes such as history and physical uh, consult, discharge summaries, and operative notes, etc. So we have also the pharmacy system, which allow for maintaining a drug formulary, filling prescription, as well as cross-checking any order that are placed by providers in the electronic health records. We also have nursing components, which allow for collection of key patient information such as vital signs, such as input and output. So these are the components in clinical component of like electronic health records. Another component of electronic health records that support direct clinical is laboratory component, which include capturing results from lab machines as well as integration with order, billing, and lab machines. We also have another component, which is radiology information system, and picture archiving and communication system, which is used to manage patient workflow, ordering process, results, and the images themselves. So these are the three components that of electronic health records that support direct clinical care. Like I can repeat them: there is clinical component, there is laboratory component, as well as radiology information system. There are different benefits of these components of electronic health records that support direct clinical care, and among those benefits we have according to Health IT 24.gov/2014, they reduce medical errors uh, since these components of electronic health records improve the ability of to diagnose disease, which lead to prevention of medical errors. We also have um, we also have that it enhances patient care. We also have that another importance is that it saves time. It leads to improved care coordination when there is a better integration among providers by improved information sharing. The another benefit is the quality of care, where the right things are done at the right time in the right way and to the right person, and it produce or it result into the best like it give the best result. So there are also the issues. There are still the issues in this component, and the first issue is financial issue, which includes adoption and implementation, where the the users of electronic health records have to do training, so that's money that requires money. And there is also disruption of workflow for medical staff and providers, which result in temporary losses in productivity. So the another issue is that the risk of patient privacy violation, since their information are being shared electronically, so it can lead to violation of the patient privacy. There are also moving on the components that uh, moving on the components of electronic health records that support the direct administrative processes. We have uh, we have patient management component, which is required for patient registration, admission, as well as transfer and discharge. So the patient registration includes key patient information, such as demographics, insurance information, and also contact information. We also have another component of billing system, which is used to capture all the charges related in the process of providing the care to the patient. So like here we have two components. The first one is patient management, and the second one is billing system. So there are also the benefits for this component, which support administrative process, and the benefit is that it reduces errors because all medical observation, tests, procedures, criticism, assessment, and diagnosis are linked by the patient identity. So another benefit is that access of patient information. It's easy to access the patient information wherever and whenever they are needed. Another important is that it's easy the sharing of information among doctors. For instance, if I went in like one hospital, like and they provide to me the care I need, and in case I went to another hospital, they can access those informations because there is a sharing of information, which is easy. Another importance is that it will improve communication with office, and also which is the assigning the task since it is electronically. Another benefit is that it reviews staff productivity. It's easy to review staff productivity by examining healthcare providers and staff output. So there are also some issues in using these components, and the first one is some errors occurs in billing, like and also the patient privacy. There is still a patient privacy violation since the messages or the messages or the patient information are shared electronically. So moving on the last question, which is importance of integration of administrative and clinical area for effective use of electronic health records. According to Athena Health 2017, it's easy access to clinical data. uh, the integration, like this integration, easy the access of clinical data. It enhances the ability to establish and maintain effective clinical workflows, like fewer medical errors occur since there is improved patient safety and stronger support for clinical decision making. And also another bit important is that the opportunity to interact with affiliated hospitals, clinics, labs, and pharmacies. And also there is a greater staff and provider efficiency due to the ease of recording, storing, managing, and retrieving patient information. Another importance is recording and tracking of quality measures, which enables improved physician productivity and access with incentive programs. And also the last one is, but not least, is a more efficient and cost-effective workflow. Thank you for um, listening to this. There is also a script for this for whoever who needs it. Thank you very much.